Welcome dear students, this is Dr. Pratyusha, and after having learnt of all the infective etiologies of otitis externa, now let us come into the second group, that is reactive causes. Reactive causes. Otitis externa. The first one under this category is allergic otitis externa. So what is allergic otitis externa? Sometimes edema and purulent discharge is seen in the external auditory canal, and that occurs because of some allergy towards the topical antibiotic or steroid or antifungal drops that we have used, or because of any ointment. So it is an allergic reaction towards all these things and not exactly an infective etiology. So what do we see here? Allergic response to topical drops or ointments used. And it is characterized by a maculopapular eruption, Maculopapular eruption is seen right from the concha to the external auditory canal. And how is the external auditory canal? It is thickened and reddened. Thickened and erythematous. Thickened and erythematous external auditory canal is seen, and edema and purulent discharge is also present. Now, how do we treat it? Treatment of any allergic condition is by withdrawal of the offending agent. Whatever has caused this has to be withdrawn immediately. That is the first step that we do, and along with that, topical steroid drops can be given. So that it subsides the response. This is allergic otitis externa. It's very simple, not because of some infection, but because of some topical drops that the patient has used. There is an allergic response that is characterized by a maculopapular rash, thickened and erythematous canal, edema and purulent discharge is seen, and we can treat it by withdrawing that agent and also giving topical steroid drops. Second condition here is contact dermatitis. If you remember, external auditory canal is also lined by skin, and just like skin elsewhere in the body, responds to some irritant substances by producing contact dermatitis. Same with external auditory canal. Any hairsprays or shampoos or hearing aid molds can cause irritation to the skin, and that results in contact dermatitis. So the most common substances causing this are hairsprays and shampoos, hearing aids, or any other substances that have been put into the ear. Now, what is the characteristic feature here? Here also, the external auditory canal is thickened and erythematous. How do we treat it? Same, eliminate the offending agent and do a debridement. Now, allergic otitis externa and contact dermatitis might appear very similar, but there is a slight difference in their pathogenesis. Allergic otitis externa is mediated by IgE and immunoglobulins, and contact dermatitis involves a slightly different process. But what we see broadly, they are the same. It is because of some irritation to an external substance, and our treatment is withdrawal of that substance and debridement along with steroid drops. Third condition under this is Seborrhea, seborrheic otitis externa or psoriasis. Now, seborrhea is usually seen on the scalp, and the same seborrhea of the scalp can result in seborrhea of the external auditory canal also. So, here this is characterized by hyperkeratosis, and lichenification of the skin of external auditory canal. The reactive group mostly involves the skin conditions, the dermatological conditions. So, this is usually associated with seborrheic dermatitis of the scalp. If we observe in a patient of seborrhea of the external auditory canal, we also see that he is suffering from seborrhea of the scalp. So, the main complaint that the patient has is itching, and greasy yellow scales can be seen in the canal, very typical of seborrheic dermatitis, greasy yellow scales. They can be seen in the external auditory canal and also on the pinna also sometimes. And the treatment for this is application of salicylic acid and sulfur cream along with treatment of seborrhea of the scalp. %2 salicylic acid and sulfur cream can be applied. But most importantly, treat seborrhea of the scalp. This is about psoriasis or seborrhea of external auditory canal. And the last condition in this group is neurodermatitis. In neurodermatitis, for some unknown reason, the patient has an irresistible desire to scratch the external auditory canal, and it could be because of some psychological factors also. There is an intense itching and he has a desire to scratch. The patient is complaining of intense itching. And a compulsive desire to scratch. Now, this could be triggered by some psychological stressors. And this is followed. Now, because of that scratching, what happens is, as we have learned in most of the etiologies, there is a raw area, micro abrasions formed, and that will lead to secondary infections again. And infections will again cause itching and pain, and the patient scratches again, and it's a continuous loop. In between, the patient is scratching due to psychological factors, and later on infection also leads him to scratch, and finally it's a loop. So how do we treat it? By giving psychotherapy and behavioral therapy to the patient, because that is the root cause, and if at all an infection has already occurred, treat the infection. Behavioral therapy and treat infection if present. So when a patient is complaining of itching in the ear, first rule out all the infective etiologies and every other cause, contact dermatitis, all the other reactive conditions, and finally this should be the last thing in your mind, that this is also possible and the patient is just scratching because of some psychological stressor. So this completes our topic of otitis externa. Now, after having studied about all the different types of otitis externa, let us summarize all of them into one single table for quick and easy revision. So first, as I said, otitis externa is of two types, infective and reactive. First being infective. Under infective, our first category was bacterial. Under bacterial again, the first one being localized otitis externa. It was also called as furuncle. Next column, etiology. What is the etiology of furunculosis? Most common organism is Staph aureus. And what are the clinical features? Pain and tenderness of the ear. I am writing only the most important points. This is about localized otitis externa. Second under this category is diffuse otitis externa. Diffuse otitis externa involves the entire external auditory canal, unlike furuncle, which is a single or sometimes multiple boil-like condition. But diffuse otitis externa is present all through the external auditory canal, and it is caused most commonly by Pseudomonas, followed by Staph epidermidis, followed by Staph aureus. And the main features here also are pain, tenderness is of course there, but discharge is present. A serous discharge is present. And diffuse otitis externa has two phases, acute and chronic. And the symptoms and clinical features depend upon the stage. In acute also there are three grades of severity, mild, moderate and severe, depending upon the swelling and edema of the external auditory canal. Chronic is if it lasts for more than 6 weeks to about 3 months, and in chronic stage the final end stage is a permanent narrowing of external auditory canal, which is called as chronic stenotic otitis externa. So this is all about diffuse otitis externa. And third under this category we have malignant otitis externa. It is an invasive kind of disease. that affects not only the external auditory canal but also the tympanic membrane. Sometimes it can go up into the skull base and jugular foramen and cause cranial nerve palsies, and it can also involve the other surrounding structures. And here also it is mostly by Pseudomonas. And most important point is this is seen in an immunocompromised host. What are the clinical features we see here? Initially there is excruciating pain. Along with that, we also have granulations in the external auditory canal. And later on, if the cranial nerves are involved, some other special features are also seen, depending upon the nerve that is involved. With this, I complete the bacterial variety: localized otitis externa, diffuse otitis externa, and malignant otitis externa. Next, we have viral causes. Under viral causes, the first one is Ramsay-Hunt syndrome. It is also known as herpes zoster oticus. Just going back, other names for diffuse otitis externa are telephonist ear, swimmer's ear, and tropical ear. Other name for Ramsay-Hunt syndrome is herpes zoster oticus. And the etiology is reactivation of varicella zoster virus, in the geniculate ganglion. The infection spreads further into the facial nerve, spiral ganglion, and also into the inner ear. And the clinical features are vesicles are seen all along the course, in the external auditory canal, in the pinna, soft palate, and everywhere else. And facial nerve palsy is also seen. Vesicles are seen, facial nerve palsy is seen, and the vesicles are painful, of course. Next in this category we have otitis externa hemorrhagica. It is caused by viruses such as influenza virus, and also some bacteria. It is not exclusively a viral condition. Bacteria such as Mycoplasma pneumonia and Haemophilus influenza also cause otitis externa hemorrhagica. And the clinical features are hemorrhagic blebs or bullae are seen along the external auditory canal and also the tympanic membrane. And also hemorrhagic discharge is seen. Ear pain will anyhow be present. These are the two viral conditions. Next variety is fungal. In fungal, we have a single condition that is called as otomycosis. Otomycosis. The common etiological agents are Aspergillus niger and Candida albicans. We have studied that Aspergillus niger gives a wet newspaper appearance and Candida gives a curdy appearance with wet and macerated look of the external auditory canal. In clinical features, itching is the predominant symptom, itching more than pain. And all fungal conditions are usually seen in immunocompromised patients. So there is itching and pain as the most important feature. With this, we complete all the infective etiologies, and the second group is reactive. The second group is reactive. Under reactive conditions, first one is allergic dermatitis. Etiology here is allergic reaction towards some topical drops used by the patient. And clinical features are, there is thickening and reddening of the external auditory canal along with a maculopapular rash. Second condition is contact dermatitis. This occurs because of some hairspray or a shampoo or a hearing aid that the patient is using and is not compatible with him. And this is also characterized by thickening and reddening, erythematous appearance of external auditory canal. The next condition is seborrhea of external auditory canal. This is usually associated with seborrhea of the scalp. And it is characterized by greasy scales. And the patient complains of itching. And the last condition is neurodermatitis. Here, the patient has, the etiology is because of a compulsive desire to scratch. And the clinical features, microabrasions are seen because of the scratching, and these are followed by infections. These are the various conditions under otitis externa, and there is one more column left in our table, and that is treatment. I have not written it separately for each condition because for all the infective conditions except I think furunculosis, the common treatment is oral toileting, cleaning of the external auditory canal, and second is antimicrobial treatment. That could be antibiotic or antiviral or antifungal. That is the next step. And also sometimes steroid drops are used. This is the common treatment for more or less all conditions in the infective group. And in reactive group, the treatment is For allergic and contact dermatitis, it is withdrawal of the offending agent. And we can also give some steroid drops to control the itching. And in case of seborrhea, 2% salicylic acid can be given along with treating the seborrhea of scalp. And for neurodermatitis, behavioral therapy is the treatment. With this, I complete the topic of otitis externa. I hope you remember everything and it is very clear. Infective, under that bacterial, localized otitis externa, diffuse otitis externa, malignant otitis externa. Under viral, we have two conditions, herpes zoster oticus and otitis externa hemorrhagica. And fungal is called otomycosis. In the reactive group, we have allergic dermatitis, contact dermatitis, seborrhea and neurodermatitis. You should be able to make this table on your own at the end of this class. And that concludes our topic of otitis externa. Thank you very much.